Your body works hard to keep you balanced, but if a function like your inner ear or your eyesight is thrown off, the world could go spinning. Dizziness ranges from a mild annoyance to a symptom of a larger medical issue. And here to tell us more about it is Dr. Oluwatosin Thompson, a neurologist at GBMC. Dr. Thompson, welcome.
Thanks for having me, Elsa.
Happy to have you here. So tell me a little bit about dizziness. There are different types.
Yes, dizziness is really a term that can mean different things. People can call dizziness a spinning sensation, which is technically called vertigo.
Yes.
And dizziness can also refer to a feeling of just being unsteady on one's feet. And finally, dizziness can mean lightheaded or feeling faint.
So what are the common causes of dizziness? Like many people, I've experienced it, but for different reasons.
Yeah, great question. I mean, there are really many causes, but if the few ones I'll touch on, most common one is just a drop in blood pressure when the person goes from sitting or laying down to standing. And that can be caused by just being dehydrated, it can be caused by medications, and there are certain neurologic diseases that can cause problems with maintaining one's blood pressure. And of course, the management for for being dehydrated is, of course, especially now the weather's getting warm, is to stay hydrated. If there's a concern for a medication problem, it can just talking to your primary care doctor about your medications is the first step one should take.
When you experience dizziness, how do you know if it's something that's just like something that's passing, like, oh, I just got up too quickly, or if it's something more serious and I need to seek medical attention?
Very good question. The key thing is that if you have dizziness with stroke-like symptoms, you should seek immediate medical attention. That's really the important thing. So if you get dizziness with symptoms like, let's say, double vision, difficulty speaking, weakness or numbness in your face, arm or leg, those are all red flags that should cause you to seek immediate medical attention.
What do you see from your patients when they come in to see you? What are some of the common reasons that they're coming to see you?
Yeah, so in addition to just being dehydrated or medication that's causing the blood pressure to fall too low when they stand up. Other things too are conditions that can affect the inner ear, the structure in the ear, and that can cause dizziness. And of course, conditions that affect the central nervous system that can cause people to feel dizzy.
Now, is there an age range that we will experience more of this? Does it happen when we get older, when we're younger, or at any time?
Oh, dizziness affects everyone because there's so many causes for dizziness. But of course, certain age groups are more at risk for certain things. With the younger middle-aged population, might be because of a migraine that they're dizzy. And of course, as we get older, inner ear issues and things like central nervous system problems like strokes and so on can be more of a cause for dizziness in that age group.
You've been a doctor now for how long?
For about 4 years now.
For 4 years now. How is it when you're treating these patients and you're able to finally diagnose their problem? Because I feel like a lot of times we just deal with these issues, especially something like dizziness. We think we're never going to get past it, and then you're able to help them.
It's very satisfying. We have procedures that we can actually do in the clinic and get patients feeling better, or even sometimes back to normal right then and there. I mean, that is absolutely very rewarding.
Tell me a little bit more about this clinic too, and what you do there and your staff there.
Right, so we're at GBMC at the Neurology Center there. There are 4 of us in the practice, and we see all patients, all comers, we have a good support staff and all of that, and you can reach us at our number will be on the screen.
That's what I was going to ask you, how we can schedule an appointment to meet with you.
So you can call us at 443-849-4145.
Okay, we'll put that information on the screen. There it is.
And another good way is, of course, to go online to our website, gbmc.org/neurology. And actually, if you click on the provider's face, you can actually schedule an appointment online.
Oh, perfect.
So that's pretty cool.
Well, we'll click on your face.
Yes.
There we go. That's super
there
easy
we go.
peasy. Thank you for being here. I think this is, really important information, especially for something like this when we're, when we're concerned about our health, to have a friendly face to click on.
Absolutely.
So thank you. We'll be right back with more Midday Maryland right after this. Stay tuned.